That's the number 7.
Number 5 and 7.
5 and 7.
As one.
Okay, got you.
You might want to mention something that's in both of those, but
Right. Sure.
do them together.
Sure. But we want you to respond in your own words however you want to respond. We're not trying to put words in your
So
mouth.
Survivor Network is the main thing that.
This will be on the Survivor Network.
Okay.
First of all, just state your name.
Better with or without glasses. I guess I'll leave them on.
State your name. Affiliation.
Right now? Okay. I'm Dr. Henry McGowen. I'm an MD, at this point in time a radiologist. I've been many things in my life. I was a general practitioner in Baton Rouge, Louisiana. I've been in Louisiana. I'm an LSU graduate. I graduated from medical school in 1965. My undergraduate was in petroleum engineering, and then I went on into what I really wanted to do mostly was medicine, so I switched over. Probably conflicted with the fact that I really just wanted to be outside, and I ended up being inside. And then because of the scientific connection, after doing general practice, I decided to go into radiology because I like the scientific end of it, and sort of concluded that nothing really happens till the correct diagnosis is made. So that's why I decided to get into diagnostic. I was board certified in both radiation therapy on the therapeutic end and also in diagnostic radiology and nuclear medicine. I'm a fellow of the American College of Nuclear Medicine. I'm a fellow of the International College of Surgeons. I'm a fellow, I'm a diplomat of the American Board of Radiology and belong to about 8 or 9 different professional organizations, including the AMA, TMA, and a lot that are for our society. So that's basically somewhat credential-wise.
Explain what a police surgeon is.
Police surgeon I got into in my hometown. I started out just doing some deputy work and went to medical school. My far background was in road construction, and I went out to West Texas, did some things in the oil fields, and West Texas Electric, and off and on, but finally with college went through on those 2 venues. And while I was in town, once I became an MD, I tried to help out the police department any way that I can. Now, my experience as a police surgeon will be different from a larger city. Our town was about 125,000, but you go into your larger cities, that's a more specific position and it's full-time. I have always had a very soft spot in my heart for our fallen warriors, whether they be military or with the police department. I put them both on equal par. Police department's just in war all the time. It's the only difference. And my dad was the commanding officer of Manila during World War II, and of course you can't have I was 10, 11, 12 all through World War II, and you can't have a dad off fighting and you're getting reports every day without your patriotism just always being there. And
did he stay in Manila?
Did he what?
After the Japanese overran Manila, did he stay there?
No, MacArthur, he was working in an executive position as well as commander of Manila, and he more or less forced him to come back with him to train the troops for coming back. MacArthur strongly, I don't think he would have ever left if they hadn't said you can come back.
And to Australia.
Well, no, he was training the troops to come back. He did a lot with the troops in Phoenix, Arizona because of the heat. they called him the walking colonel because he would do full packs, full rifle gear, everything, and go on a 12-mile march, turn right around, drop them out with a lot of the recruits passing out or having to be brought back on stretchers, get the next group, take them on the 12-mile hike, and come back and often do 3 in one day in 115-degree temperature, sometimes 120. I remember as a little kid, I was always impressed. Everybody, I guess, has to do that. Fry an egg on the sidewalk, and you could do that in Phoenix. They sort of moved where the heat was. They did work in Louisiana during the heat of the summer because of the mosquitoes, and but the whole preparation was to get back. And of course, when they did come back, and that's when he was commander of Manila. But I remember when he had come back, then medically they didn't know as much, and the whole answer to everything was salt tablets. And when he would come in, he'd take off his pants and his shirts. They stood up by themselves, and they were white from the amount of salt that he would sweat out during the day.
So you had an affinity for not only military but for law enforcement.
For law enforcement, I think that's an ongoing battle that is always there. We wouldn't be a nation of laws if it wasn't for a good law enforcement. And I feel any lay people, anything they can do to help our police department needs to be done. Often there would just be a young officer that was new in town. I was in the medical field. I could get them appointments where they might say, oh yeah, it'll be 3 months to get in. Well, we can get them in when they need it and put in a word for them, do a little forensic work on the side, just whatever would help. Currently, with my expertise in radiation, I try to go to all the courses that we have on anti-terrorism for radiation or bioterrorism and keep those expertise up. Hopefully that would never happen, that we'd have a local dirty bomb, not the big bomb, but just a little local dirty bomb or bioterrorism. There's certain instruments that you need to have available, and hopefully that's something I'll never have to use, but I'll have it available if if they would like to call me to help them. So I've been sort of like amicus curiae for the lawyers, the court. I just try to be a help to the...
I bet you get a lot of police officers asking you questions about their health and
yes, we do.
Free advice.
And that was one of the more enjoyable parts of working the emergency room and being on call. You get to see all of the officers as they come in, bringing in either patients or criminals, and you have some chit-chat time, and the fact that I was a deputy for a while, and you get some commonality and have and you stay in touch with them, and I try to stay in touch with the local police, and I'm just available to help them in any way that I can, always at no cost, of course.
Tell me about special medical concerns enforcement officers have that...
Well, they were probably very similar, at least when we're talking about death and trauma and dying, that I had. I worked in the emergency room in New Orleans. Typical every night, especially weekends, were knife and gun club meetings, and these people would come up. You couldn't even recognize them. And of course, on the stint on pathology, we did autopsies all night, just about. Whenever they would bring in a fresh somebody that had died, whether it was an accident or whatever, we would have to go in and do the autopsy along with a pathologist present looking over our shoulder. So you see a lot of that. In private practice, you had a little more personal. It's a shorter venue with the patient when you're in the emergency room. But in private practice, you'd have patients, mostly unassigned cases, that would end up being rape cases, and what they were going through. You have to do an examination on that patient. You have to try to comfort them, put them at ease, remember how they're going to misinterpret things. Mostly they need somebody to listen to them. And I enjoyed that, trying to help people. And of course then the follow-up in court, you were always a factual witness and therefore not paid as opposed to an expert witness that they were calling in. They would mostly ask you expert questions, but I just feel that's what you owe to the community, and my heart goes out to rape patients of any sort. And it's very similar to what we're talking about here with a fallen officer. Those people really feel like they've lost. They go through many of the same responses of a person who has lost a spouse. Yeah.
I'll make sure that you get your hands, please.
Oh, yeah.
That.
Yeah.
Tell me, if you were speaking to a survivor about the various stages that you go through, just like finding out you're going to die in many ways.
Well, they have the classical 5 or 7 stages that people go through. In actuality, most of the time people are going through 2 or 3 of these at the same time. The disbelief is pretty universal when they first hear, no, that didn't really happen, you're at the wrong house, that wasn't my husband, I just saw him 3 hours ago. And then the anger and the aggressive against the messenger, those are pretty much, but it's the other things that you get into where you can try to minister to the patient. And I would just like to emphasize, especially now, severe clinical depression, you need to get a doctor involved. But everybody will go through what is obvious depression. With the death of a spouse. They may even have severe claustrophobic reactions. They feel everything's closing in on them. They've got to go get some fresh air. Their world's ending there, and they can even go into hyperventilation or...
How do you know the difference if you are experiencing this between severe depression and clinical depression? I mean, you have to diagnose yourself a little bit.
You really do. Yeah, you really do, but when you get into true clinical depression that needs drugs, now we're not talking about a light tranquilizer or something, a lot of people need that, but when you need a lot stronger drugs, they have early psychotic depressive symptomatology, borderline catatonic, they're off. There is a difference. The other, they're just sad. Deep, bone, hurting, sad. And they're anxious. They may go into an anxiety attack, hyperventilate. But if they know you're there, and mostly you do need to listen. You need to listen to what they're saying, because right then they are purging some of this stuff. If they suppress it, or you suppress it with drugs, it'll be a prolonged problem. Whereas if you can let them talk, and it may take hours, but if you can just be a good shoulder to lean on, and there, if you're a male and this is a female, you ought to always try to have a female present. But they need somebody to listen and somebody to care. And if you're going to do a handoff where you've got, after an hour or so, do something else, you need to bring somebody in 30 minutes before that so they also get to know that person. And they don't feel abandoned again by your leaving. It's just common sense and finesse, but they need to be the focus of the whole thing. They're hurting like they'll probably never hurt again in their life. And you need to feel that. And people that can't have that compassion really shouldn't be the ones trying to do it. And I think your police departments should know people. Often it's the chaplain will be the best one to call in, which is associated with your organization. And chaplains go through detailed training If they weren't compassionate, they wouldn't become a chaplain. I mean, why? Why would you? And I think faith-based things work good, but that is no time to try to push religion down anybody's throat. You're there to listen, to comfort. That's it. And let them talk. Let them get it out. That's the best thing that they'll do. Realizing they're going to oscillate between these 5 phases, hopefully end up in the last one in which they accept it, they understand. And that's another part that I'm really pleased with your program, is the honoring valor. Ultimately, they'll probably be mad at their husband for getting killed. They'll feel guilty. Maybe they did drink a little bit or whatever, or he saw them with somebody else or whatever. It doesn't mean it was anything founded, but they'll go through the guilt, and they'll go through the anger at their husband for dying, as unbelievable as that is. And if anybody reacts to that, boy, you've really lost them. But that's normal, and they will oscillate back and forth, you know. And mostly, I can't express enough that they need somebody to listen, and they need to know that person cares. That's probably the bottom line. And don't hang your hat on one phase of these. Say, oh, you're going through this. They don't need to hear that, and they don't need other things pushed down their throat. You need somebody to listen and care.
Explain the importance of the first anniversary of after your dad.
Well, and that dovetails beautifully. I was thrilled to read your program that you have where you're honoring valor. After 1 year, hopefully they have reached the 5th or 7th stage, whichever way you number these, where they have acceptance, and they need to be proud. There's usually children involved. They need to pass this on to their children. Nothing will help a child grow up and mature and be a productive citizen than being proud of their father or proud of their mother. And that's what your program will address. And to have something on that first year anniversary, which is very critical, that's where they're at the low ebb. They remember the knock on the door, the phone call, they get flashbacks to everything they went through. But if the focus is on celebrating what that person's done, that'll do it.
You need some water?
Sure.
You need some water?
You need some water?
Yeah, I could use a little. I probably about said all I...
Oh, no, you sit right there. I got lots more questions. Have you been to Manila before?
And been what?
Have you been to Manila?
No, I haven't been to the Philippines at all. I'm anxious to go. I was very impressed. I had a transfer radiology resident from the Philippines. Actually, there were several of them in our residency program. And of course, they gravitated to me right away. I was senior resident, and they knew I had already decided to come to Brownwood. And I just thought it was great. The big thing they wanted to do, just like most people, they want to go see where Elvis was born. They wanted to come to Brownwood and see the MacArthur Academy of Freedom.
Yeah.
Oh, they just loved America at that point in time, but now we're talking about 67, 68. But their focus before they go back to the Philippines as a MD radiologist, they wanted to come see the MacArthur Academy of Freedom in Brownwood, Texas. They wanted to know how they get there and what would be the best way to get there and what have you.
I asked Dave why. I mean, when I first saw it, I thought,
Yeah.
this is you just don't associate MacArthur, I guess,
Yeah.
with
Brownwood.
with West Point,
Mm-hmm.
but not Brownwood. So it was a surprise to see it.
I just thought it was great, and but it shows now that part is mostly Muslim now, and their feelings. So much of it's anti-American now, and these were young men, 25, 26, 28. They just dearly loved America and realized we had totally liberated them, and MacArthur was Superman to them.
Um,
Oh, thank you, Dave.
You bet.
I want you to speak directly to the widow or the family member about what they can expect with their own health and how to attend to it.
Okay. I would say to any of the widows, and of course that will depend on the stage of recovery that they're in, they need to think of their own health. Part of that healing is your 1-year anniversary where you're celebrating the spouse's valor. But their health, they will go through a myriad of health things. Actually, physiologically, their immune system decreases. Anxiety, depression hits every part of your body. And these are normal things that they should be able to work through with proper support. And again, we get to the main line is going to be the local department. So if they can take advantage of all of your all's resources and other people's resources, there's now a setup where they have good financial things, which the department should have access to obtain to take those pressures off of them. But they also ought to be able to know either psychiatrists, psychologists that have a soft, compassionate heart to line these people up and let them know this they're not going to a shrink. This is what everybody has or needs to go through when they have a trauma such as this. And I can't emphasize enough, I think, that the departments need to do this. And probably in a town the size of Brownwood, through the chaplain's office and through the state chaplain's organization and the federal chaplain's organization be the best way to do this. And where there needs to be support for these, I think they would have access to that they might can help arrange that. But it's imperative that these compassionate people get to them, and they need to realize they're going to have some physical complaints as well as emotional complaints.
Dr. McGowen, let me ask you this, if I can. Having been in a position to probably do dozens, if not hundreds of patients, we see all different types of reactions from people when they're notified about the death of a spouse or a child or something like this. Could you just take a moment and explain to us a little bit physiologically sort of what happens in the body and why? I mean, aren't there some things that sort of automatically happen that we don't really have control of to a degree?
Yes, there is. That would be a whole study in itself, that, and that's the things in medical school that you go through in detail when you're doing your psychiatry, not psychology, but your psychiatry portion. You have a lot of chemical releases from adrenaline, serotonin, all of these things, and they affect people differently. The human brain is the most complex thing ever conceived, and from my point of view, of course, God's the only one in the world that could have done that. But and the wiring is complex, and everything builds on itself, starting with childhood. So everybody does have basically a different reaction. You can do like the general 5 responses, but everybody's different. Some you would swear they didn't really care that much for the patient. They take it very factually. Oh, okay. Others, they'll pass out. So you need to be prepared for the whole spectrum. And actually a good physician that is a good internist or psychiatrist, and try to stay away from the psychiatrists that depend on drugs as their mainstay.
I heard you say something earlier about I don't remember your exact words, but I got the feeling that a person, you would not want to over-medicate a person because that's going to sort of, I guess somebody once said, trauma says pay me now or pay me later. Is that?
Absolutely, and if you do the pay me later, it's going to be pay me later for a long, long time. So it's better, you have to, even though it hurts, there are certain things you have to go through. But they need a support system. They need their little circle support system, but understand how lay they are, and they're just trying to please the person. And they're not saying what the person needs to hear. And most of them, especially if they're men, I hate to say men fall in this thing, you give me a problem, I want to try to solve it for you. So let me start talking to you about what you ought to do. But women are a little better at listening, but close friends don't listen that much. And what they need is somebody to let them, and how they minister to them, they should take the lead from what that person is saying to them. But always 98% listening, 2% input. And that'd be a good ratio.
Thank you, sir.
Yeah.
Let me ask you this, if I could. From a medical standpoint,
Mm-hmm.
you worked emergency rooms as a doc, things
Mm-hmm.
like this. If somebody has just been told that their officer, their husband, their wife has been killed in the line of duty, there are some things that could happen physically. What things would they or their families want to be alert for that could be a true medical crisis when they've just been told about a line of duty death? What are some of the things that could actually happen that would maybe involve that you'd want to give them some immediate medical help?
Well, that would have to be correlated with what the patient's history was. Are they on drugs? Are they on non-prescription drugs? Do they do recreational drugs? Do they borderline alcoholic, or they've been an alcoholic? All of those things will affect those factors. And
heart conditions?
Absolutely, and that's the other thing, or physical. You think of an officer down, you think of younger widows or widowers, but yes, and they should know, and that's where you need to get at least the family doctor involved that knows that patient's history. They should, a good GP will know the family history of heart disease and what ages these came on. Are they at risk for having a cardiac event due to this? Are they at risk for having a true physical stroke because of this? Are they treating them for hypertension? You'll have to be sure during the depressive stage that they keep taking their hypertensive medicine, or they will become equal. Whenever somebody starts to come out of depression, that's the time they're most apt to commit suicide, and they need to be watched. It's when they're in deep depression, they are too depressed to kill themselves. They may toy with it mentally to get a little mental relief, you know, I could be out of this if I wanted to or whatever. But they're too depressed, mostly they just sit there. They don't take any action. But when you start treating them with tranquilizers and antidepressants, you may bring them up to the level that they're not well, but they now have enough energy, they can commit suicide. And when they're getting better is when they commit suicide. And those are things the families should realize. And but they have to correlate it. Are they being treated with antidepressants? What the swings are. When they first start getting better, that's when everybody says, oh, I can finally take a break. And they really ought to be with them more. Because that is the danger time. When they first start coming out of depression, they still remember how it hurts, you know, like these commercials. Who does depression hurt? It hurts everybody. And who? How does it hurt? It hurts everywhere. Those are true commercials. And if the people, as they come out of it, that's when they finally, they can remember how bad it was. They won't ever be there again, but now they've come out enough they can commit suicide if they really wanted to. and that'd be a good time to minister to them.
I've heard people say, you know, Joe's been gone now, whatever.
Mm-hmm.
And I went to a movie with a friend the other day, and got to laughing, and I felt guilty for feeling good. Does that, tell me about, I mean, does that happen?
Oh, absolutely. And that's where the good lay friend could easily minister. They need to tell them, remind them all the good things that they had done, and what that they knew the husband. He would have been thrilled that you were having a good time. That'd make him happy. He's smiling up there in heaven because he sees you finally having a good time here. He would have done it for you himself if he could have. You know, just good logical things that they need to hear. And that again is all these 5 steps. You know, that's one of them, guilt. That's way up in the middle. But you'll bounce. But that's an important one that needs to be addressed, and it's best addressed by friends that knew what the husband was like.
I've heard some things I have never heard before.
Mm-hmm.
I've talked to a lot of people about this,
Well,
so I really am.
Well,
That's what I wanted to do. I was excited when you walked into Bobby's.
Some of that advice is so vital. You just don't even, I would never even have thought about it.
most of it's just logical. People are people.
No, it's not. It's not.
Well,
Some of it isn't. Some
yeah.
of it isn't. And it
So-
takes someone like yourself. And I know there's a lot of chiefs out there that need to know this information.
Yeah.
And they need to know before. You know?
Oh, they have to be prepared. That's the whole thing. Get it ready ahead of time.
How would you
Have
prepare?
it.
What would you tell, like Bob Grubbs or Virgil Cowan or any? What would you? I mean, how
I would get information like you're doing here, and ask for a meeting. Let's get together and come up with a death plan. Officer down.
A lot of departments are superstitious about that.
Uh-huh.
And
Well, they are. It's just like, of course, my reference always flashes back to World War II. You certainly never wanted to say you had one mission left or this, that, or the other, or talk about other people. But I think if they realize they're talking, they owe this to their officers, and they're talking about what will help them, that we hope it never happens, and you have to consider they're in the top pay grade, so they got to overlook that. And it's for their men, not them. They're not going to get killed. You know they can, and I know they can. But to have a plan, and I don't think it has to go past them, because just the chief deputy, you know, you're not going to get both of them at the same time, and there ought to be a series, and I think it ought to start with the chaplain, because you all have access to most, you know, just the program you're putting here, and make that available for them. And hopefully they could listen to some of these things. And then I think it would be good, most doctors are responsive to law enforcement and to wanting to help law enforcement. And if you would ask to be the program along with the law enforcement officers, both police and sheriff, at probably the county medical society. The county, we pay dues that pay for the meals and what have you, and we always leave us time. This could very easily, and you could talk to the president of we have now 4 county medical society to apply for credit for this, and they can get a 1-hour ethics credit. And the state of Texas requires that you have 1 hour of ethics every 2 years just to get your license. And most ethics things are boring, but they do things just like we're talking about with doctors that die, and doctor spouses who they've lived a little beyond their means and don't have anything, and doctors that get on drugs and have to go through rehab, all of those, along with the general ethics you think about as ethics. And this would fall definitely in that category. How a patient that they have, officer down here will have one of the doctors in this community will be his doctor. And try speak ahead to the psychiatrist and ask if they can be there and tell them you'd like to have their input about this. And maybe even ask if you could record the session just where they were having discussion and the psychiatrist was talking. But every time there's an officer down, hopefully at that medical society, that officer's doctor is going to be there. And they can get credit for it. People will always usually go to that ethics thing because it's a hassle. You can get it online. You can go to Austin and get it. But it's nice to have a meal. Whether you go or not, you've paid the dues to pay for the meal. And they get that credit. And you're just sitting there. And so I just asked. I think that'd be great. And I do that every few years. Say, let us be your ethics hour. Talk to the psychiatrist. We have a nice young female, I say young, I'm sure she's 45 or so, female psychiatrist, which is a very gentle, nice person you'd enjoy talking with, and then the doctors themselves, because they're going to be the doctors of these officers. And I think it'd be a good time to put the two together. And most of them would like to.
Is there any advice, just one last question here, to the officers? So many officers die, my father included, very quickly after they retire.
Yeah.
And just because the job wore him out, first of all, didn't take care of himself. And they don't get to enjoy that retirement that they think about, all the time.
Yeah.
And what advice would you give them about taking care of themselves or retirement?
Well, I think that's paramount, and doctors are the worst people in the world to address this, because there are some that take very good care of themselves, but most doctors just burn the candle at both ends and don't do physical things. And some do. Of course, your physical activity is real important. Hopefully the police departments will have a good physical program with weightlifting and cardiovascular, and if the departments don't, I think it ought to be encouraged. I think there needs to be also seminars prior to retirement, because most people feel lost. They felt important. They're getting an input, and the non-working female spouses will tell you in a hurry, you get to go off to work and you do all this. Well, it seems awful hard. But I can see their point of view too. But when you get retired, you're back where they were, and you can feel lost. There's more deaths shortly after retirement than any time else. And I do think the stress of the job, my dad died after he got back from World War II, and he told me that no one from World War II talked about it very much. But on one occasion he told me, son, I never did figure I would ever get back. But he said, my one hope was that I would be one of the very lucky ones that their body got sent back home. And that was the extent of their hope, really. He, in hand-to-hand combat, he was a frontline colonel, and he killed Japanese in his tent while he was sleeping on 2 occasions. They were trying to bayonet him. And But he survived, and I can understand. Of course, they didn't see an end to this war when they were in the middle of it. And when he came back, he finally died from, it's a combination of all the stresses when you go from one job to another. Even if it's retirement, he went into a civilian job, which is a major change, and he just really kept an ulcer he got during the war, and finally it penetrated into his pancreas, and he died from complications not that long after he got back from the war. So it was similar to your dad's death. He died, he was 60 when he died. Yeah, I think there does need to be a preparation for, you need to think of it, you need to start getting into some kind of hobbies, or a lot of time second professions. You know, I've toyed with, you know, do I want to write a book? Do I want to do this? Go back and play a musical instrument. But you need to find something to do. And right now I'm just catching up on surgeries and things I put off for all these years. And then I'll decide what to do from there. I've seen other people that are just happy as a bird when they retire, and others that die within 2 years. So not a good answer except preparation and faith. I think a God-anchored faith is the answer. I really do.
Thank you.
You bet.
Henry, thank you so much. I knew you'd be good.
No, I don't know about that.
This has been a tremendous.
Thank you,
God
sir.
bless you.
Henry.
Sorry about your father.
You got a 62.
Oh, very close to the same age.
Henry, I need
Yeah, I
to
I don't want to mess your
Oh, there you go.
thing up.
If you will, jot your mailing address down